there's the type of event that you do that you are likely to lose your license or job, right? Depending on culpability, which we'll get to that in a sec. But there's also the type of event you won't, but people will still fear that, okay? So we call that culture problems. So the idea is that we have this concept of just culture, and we'll come to that slide in just a sec, but I wanted to prime you up for it. So culture plays a role. Your safety culture plays a role into whether an event gets reported. Anything else anyone can think of? Those are the big three I was looking for, but I don't know if anybody thought of it something else. Good. Okay, let's move on. Hey, what do you know? That's convenient. All right, so whenever we talk about culture, so there's this idea of a punitive culture, and I corrected my spelling on this slide, so if you want to correct the spelling on your slide, that's fine. So a punitive culture. So we don't really see a lot of these. Sometimes they're more perceived than they are real, in the sense of if I'm implicated in an error, then I'm going to get punished. And that shouldn't always be the case, right? Because sometimes, humans make errors. You will all, I'm sorry if I'm the first person to tell you this, but you will all make a mistake in your career. Y'all will all screw something up. It's inevitable. It's not your fault either, necessarily. It might be, depending on the event, and we'll go through that. But realistically, even if you do everything right, you follow every procedure, you follow every guideline, every standard of care, and you're diligent in your process, you're still going to make an error. And the question is how severe is that error versus not? So if we have a punitive culture, we have no tolerance for that human factor. We have no tolerance for the fact that people make mistakes, and that's okay. You've heard me say at least once, I know probably more than that the most important thing we can do when we design processes for people is help good people make good decisions, right? And so that's what we're talking about here. You're not focused on processes, you're focused on people, and if something bad happens, that we need to punish the person. That's not quite right, is it? Then there's the blame-free culture, which goes to the other extreme, which sits there and says, okay, so if we make an error, we're all human, it's all good, hug it out. Patient died, but hey, yeah, no, it's fine, right? So we don't want to go that extreme either. So we balance it with this idea of just culture. Just culture is the idea that we give people the benefit of the doubt. We realize that humans make mistakes. But was the person complicit or culpable in their own mistake? Did they know that they were doing something wrong? Did they deviate because it was easy, not thinking about the consequences? Or were they trying to do the right thing and it just didn't work out? This is complex. So I expect you all to memorize this. This will be an essay question. I'm just kidding. No, please don't memorize this. A lot of this is common sense. And so what I'd like to do is walk you through this. If we have a culpability question, I'll provide you this slide, okay? But you need to know how to navigate it, all right? So looking at this, so we ask ourselves the question, so was the action intended? Okay, so did they mean to cause harm? Did they mean to do the thing did they mean to do the thing that caused harm? If yes, then we need to ask were the consequences intended? Were they trying to harm the patient? And if they were, then yeah, no, culpability is pretty high and that's a malevolent act. They're trying to hurt a patient. And unfortunately, it's very sad that this does happen. It doesn't happen a lot, but it does happen. Okay, let's say that the action wasn't intended, okay? Excuse me. Were they under the influence of a substance? Unfortunately, as healthcare providers, we have a little bit of too much access to things that most normal people don't have access to. So sometimes we make very poor decisions. This may not be theft of a substance. It could be that you hurt yourself at work and you've got a prescription for Vicodin and you've just been taking that Vicodin for your pain, but you take it at work. So if you're influenced on a substance, okay, is it due to a medical condition? In other words, were you prescribed it and was it a reason? Well, okay, yes, then substance abuse and there was mitigation. Non-medical condition, this red, this is you're going to get sued and you may actually do prison time for these red things over here, okay? The gray gets a little more, it kind of depends, right? Probably litigation will be involved. People will probably lose jobs, that kind of thing, but you're probably not going to do any jail time. And then green is, it just happens, right? So if we go through this just a little bit more, so knowingly violate safe operating procedures, yes. Then were the consequences that intentional? Then it was reckless violation versus the consequences weren't intended. I was just doing a workaround, right? Workarounds happen a lot in healthcare. That's a system-induced violation. So you probably won't get sued or anything like that, but you may lose your job or some other type of disciplinary action. Knowingly violate safe procedures, no. And does it pass the substitution test? What do y'all think that means? What does substitution test mean? Yeah.
Maybe would somebody else reasonably have done the same thing that you did?
Yeah, exactly. Someone of your same level of experience and expertise and under the same circumstances and situation, would the exact same thing happen? So versus a negligent error versus a system-induced error. And then you have, over here, you have a blameless error if, yes, we pass. Oh, that should be a no. I'm so sorry. That should be a no. That's a yes. So then it's a blameless error. Most of what we see really does fall in this green category. This red occurs very rarely, but it does happen. And then the gray does happen sometimes. Questions about this culpability diagram? Good? Okay. Y'all are going to have it memorized by tomorrow, right? Okay, so some of the human challenges that occur here, so we have workarounds. We kind of already talked about that. That's whenever the process is terrible, and so we develop something to circumvent the process. Overly complex processes, so if it requires too many steps and those steps are intricate, it's more likely that we're going to screw up, right? Unclear processes. We see this sometimes where, you have some institutions, like I use my old workplace, Harris Methodist Fort Worth. We had policies for policies. There was, they were such a robust institution that they had there wasn't anything new. It didn't feel like there was anything new. If you were doing something, odds are there was a policy or procedure for that, probably both. You go to some other organizations that are a little different, maybe a newly formed hospital or newly formed organization. Processes tend to be a little less clear. They're dependent on humans to do things. And the more reliant we are on humans, the more variation we create. And if the more variation we create, then the more likely we are to have an error. All right, so I'd like y'all to let's apply this harm, preventability, and culpability. Okay? So let's look at these three cases. Just pick whichever one you want, 1, 2, or 3. It's up to you. What I'll do is I'll just ask somebody for each group to report out, for one of the cases. So not everybody's going to report out. So you might get lucky. But I'd like you to look at these cases and look at the harm, preventability, and culpability. And then I'd also like you to discuss the case that I gave you verbally at the beginning of the session. I'd like you to talk about that and see what you think as far as the harm, preventability, and culpability of what went wrong with that patient. Okay? And there were a couple things that went wrong, so you can pick one or you can try and tackle them all. It's up to you. I'd just like you to think about the case a little bit more. And those of you that took notes, please do not chime in with your notes. You're welcome to look at your notes, but please don't just give them a whole bunch of refresher information that they didn't capture. Is that fair? So you get to be a pseudo-observer. Participate in the discussion, but please don't add information. Is that fair? Y'all understand? Okay, so just be difficult. All right, good. Let's take, it says 15 minutes. I think 10 minutes should suffice, and then we'll trudge through the rest of this.